Good afternoon. My topic is specialty surgeries for resident. Now, I don't have the person who was supposed to be saying is a must, so I don't know what points I should be talking, but I will just give you my opinion. World Health Organization report, which came last October, said at least 2.2 billion people are with vision impairment, which including vision impairment, and that has been addressed. And at least 1 billion cases with visual impairment, which could have been prevented or have yet to be addressed, which includes unaddressed refractive error, glaucoma, diabetic retinopathy, unaddressed presbyopia. And when they looked at the regional comparison, they found that the people with vision impairment that could have been prevented or is yet to be addressed is mainly in the Southeast Asia, South Asia, and East Asia. And the recommendation is revolving around integrated, people-centered eye care in health systems to promote high-quality implementation, health system research, monitor trends and evaluate progress, raise awareness and engage and empower people and communities about eye care needs. Integrated people-centered eye care can help address significant eye care challenges that many countries, including India, face. A range of effective strategies are available to address the needs associated with eye conditions and vision impairment. These include health promotion, prevention, treatment, rehabilitation strategies, some of which are among the most feasible and cost-effective of all healthcare interventions to implement. Diabetes, as global prevalence is 8.5% in 2014. India has one of the highest prevalence of diabetes in the world, with estimated 72.96 million in adult population, and which is predicted to be 79 million by 2030 and 109 million by 2035. This was the report published by the National Diabetes and Diabetic Retinopathy Survey. And according to this government survey, 11.8% prevalence of diabetes in India, with known diabetes 8%, new diabetes 3.8%, and diabetic retinopathy 16.9%. Sight-threatening diabetic retinopathy 3.6%. Blindness among the diabetes was 2.1% compared with 1.06% globally in 2015. Visual impairment was 13.7% compared with 1.06% globally in 15. And then come to the age-related macular degeneration, which is the leading cause of vision loss in those aged 60 years or older, and the morbidity is expected to rise with the increase in life expectancy. India has about 77 million people at or above the age of 60, representing a large group vulnerable to vision-related disorders, and the number is estimated to reach 180 million by 2026. So diabetes, retinopathy, age-related macular degeneration, glaucoma are on the steep rise in India, largely due to aging population, changing lifestyles, and enhanced life expectancy. This emerging scenario emphasizes the need for established models providing high volume and high quality comprehensive eye care services. World Health Organization Global Action Plan emphasized providing comprehensive eye care using health system approach to achieve universal eye health coverage. And WHO defines universal eye health coverage as ensuring that all people have access to needed promotive, preventive, curative, and rehabilitative health services of sufficient quality to be effective, while also ensuring that people do not suffer financial hardship when paying for these services. WHO has proposed 6 building blocks for development and strengthening of comprehensive eye care, and well-trained ophthalmologists is one of them. Association of Community Ophthalmologists of India have reframed their agenda from Vision 2020 Right to Sight in 2000 to universal health care at the dawn of 2020. We have plenty of community care models like Sitapurai model, Narayan Nethralaya Chitrakoot model, Karnataka Internet Associated Diagnosis of Delhi, ROP model, Arvind model, and now we have the Vision Center model, which provides the comprehensive eye care using the health system approach, and these are the institutes or the mental
Sir,
mental
can you
hospitals.
summarize it? Can you summarize it, sir?
Yeah. So, Ophthalmologists of India can be the first specialty group to show that universal health care is possible, focusing on community ophthalmology service. Ophthalmologist can be the clinical lead in a multidisciplinary team in community ophthalmology service. There is a dire need to emphasize the residents' role as researchers and teachers throughout their residency. We need to encourage them to become leaders. This can be done if residency students have a great foundation of teaching and training. The potential of young ophthalmologists of India must be encouraged to take the leadership role. Residents must not be afraid to learn new technique and skills that can open opportunities for them to move on to leadership role. Artificial intelligence, deep learning is the future for early identification of diabetic retinopathy. This can revolutionize tele-screening in ophthalmology, especially where people do not have access to specialized health care. In view of the changing needs of the implementation of integrated people-centered eye care in health system, specialty surgeries for residents there should be just optional and not a must.